Y'all know what them is? Them pecan trees. Or pecan. Or the nut that made the South famous. Whatever. I don't know. This Woody, I tell you what, man. I just been a driving along down here thinking about a friend of Fat Boy Slim introduced me to her, and she laid up in this nursing home because she's got all kinds of things going on. She's an old Navy nurse too from Hot Springs. Well, anyway, she's in this nursing home called, what's it called? Blossoms or something like that. Well, let me tell you what, old Fat Boy Slim, he ripped them a new one this morning, and they screwing around with one of his real close friends, and now he don't like that. That man will go crazy on you, and he's done gone crazy. He threw me out of the damn house. I was trying to get Butter to go, and he said, piss on that dog, get your ass out of here. I got some important damn shit to do. Excuse my language, but that's exactly what he said. And so as I heard him, as I was going out, you know, I heard him in there mumbling about the Department of Human Services and the state Medicare people and all that. He's on a tear, boy, I'm telling you. And he told me, he said, I'm sending some stuff up there to some people he knows in New York. I don't know, he always hollers about that. Well, all right, that's all I wanted to tell y'all, and I want to tell you something else. I forget what it was. Oh, yeah, you better go over there now. I ain't lying to you about this, because he's really going crazy over there. You need to go over and watch on that YouTube's, watch them, the 501 Coroner. That's the name of that there on the YouTubes, and he even I get to watching them. Sometimes I get all caught up in them, and sometimes I laugh, and sometimes I say, what in the hell is he off on talking about now? But anyway, that's what he does to you. Don't you love driving down through here? Let me tell you a little bit about where we is, so this ain't a completely wasted deal. I'm on the way right now to England, Arkansas, because I gotta pick up a statement from I'm doing FBS work. Somebody down there got him some kind of affidavit or something, brother. I don't know what the hell an affidavit is, but I know he's got some friends named David. Maybe it's something to do with that. Well, anyway, I'm going down here I hope it ain't too heavy for me to lift, because my back hurts. I got to pick up this affidavit on something he's doing. He's always doing something. So I decided to come the back way, because he's all tore up, mad and everything, ripping around. I don't want to be around him when he's like that. All right, everybody, reach out, give a helping hand. That's Woody. I'm out. Tell everybody you love them, give them a hug and everything. And I love you, and I especially be praying for those people I know personally that is sick, like my cousin Vinny, Polly Bobby. He ain't doing too wonderful. But he's always got a positive attitude. I told him, I said, tell that doctor he needs some more damn pain pills. Ain't nothing, what the hell, go for it, man. And he's doing that. And then I got this other friend, and then FBS got all these friends dying and everything. I don't know, that part of it just sucks. I'm 15 minutes over, all right, there, seconds. All right, everybody, reach out, give a helping hand. It's Woody Wilson. I wish Butter was with me. I love you. Hey, everybody, it's me, Woodrow, again. Now, I'm coming in from the England Highway. I'm headed north toward North Little Rock. And old FBS, he done called me up, and he said, Woody? I said, yes, sir. He said, you know, you're living in my Morgan building, right? And I said, well, every once in a while. He said, all right, for that, I want you to post my last report on that no good damn nursing home on your channel, because you get more views than I get. I said, well, thank you for acknowledging that, fat boy. And with that said, here you go, ladies and gentlemen. My good friend, Fat Boy Slim, bringing you a 501 Coroner report. Here it is right now. Y'all stay tuned.
Today I'm going to talk about something that should outrage every single one of us. The way our elderly and infirmed are being treated inside certain nursing homes in this very state, in this very city. And I'm going to focus on one in particular because someone I care deeply about is inside that building right now struggling to survive. The facility calls itself the Blossoms at Breckenridge. Pretty little name, isn't it? But let's be honest about what it really is. That's simply a rebranded name for the old Cottage Lane Health and Rehab at 800 Brookside Drive. Same building, same ownership chain, same history, just different paint and a new name. And the official record on this facility is not just troubling, it's alarming. According to the Federal Centers for Medicare and Medicaid Services, this home is a 1-star rating, the lowest rating a nursing home can receive. Not average, not below average, the absolute bottom category. It also carries the federal abuse warning icon. That is not something Medicare puts up lightly. Facilities only receive that flag when inspectors document serious abuse or neglect that put residents in real danger. That warning has been attached to this home since early 2025. In January of this year, a federal complaint investigation inside that building resulted in an immediate jeopardy citation for abuse and neglect. Immediate jeopardy is the most severe finding inspectors can issue. It means that conditions they witnessed created, quote, a likelihood of serious injury, harm, impairment, or death, end quote. Not a technical violation, not a paperwork mistake, real danger to vulnerable human beings. Just 2 months before that, in November of 2024, the facility was fined more than $19,000 after inspectors found failures in basic operations, food safety violations, improper handling and securing of medications, inadequate nutrition planning, and failures in facility-wide assessment and oversight. Pretty much everything. Over just the past 3 years, the home has accumulated more than 40 deficiencies across nearly every category of resident care: infection control, accident prevention, dignity and rights, reporting of abuse, sanitation, medication management, and maintaining a safe and clean environment. Inspectors documented missing call systems, poor infection control, problems with resident funds, and a long pattern of failures to protect residents from harm. There are also lawsuits on record against the owners of this facility for alleged negligence and wrongful death, and multiple independent watchdogs list this home among the worst-rated nursing facilities in the Little Rock area. These are not opinions. These are not rumors. These come directly from federal inspection reports, Medicare's public database, state records, and court filings. And this is where our elderly live. This is where my friend is living. This is where people's mothers, fathers, grandparents, and disabled family members are supposed to be safe. And now someone I love dearly, a retired nurse who spent her entire life caring for others, is lying in a bed inside that same building. She's lying in her own waste. She has no call button. They gave her a little bell to ring. And she is fighting to stay alive in a facility that, by every publicly available measure, has repeatedly failed to protect the residents entrusted to its care. If that doesn't outrage you, then we have lost our way as a society. We spend billions on everything under the sun. We give billions away to other countries. Yet we somehow cannot ensure that the people who built this state, who fought for this country, who raised entire generations, receive dignity and competent care in their most vulnerable years. I'm asking families, staff, and former staff, if you have information about this facility, message me privately. Your identity will be protected. What you share may help us expose what is happening and push for better oversight, better accountability, and better outcomes for the people who can no longer advocate for themselves. Because if we cannot protect our elderly, if we cannot protect our young, if we cannot ensure that the most fragile among us are safe, then everything else we say about values, community, and compassion rings hollow. This is not political, this is moral. And it is long past time we demanded better. I'm the 501 Coroner. Y'all be kind to each other, okay?